why we're not saying people should self-medicate? What are some things you can do before you get to the hospital? I guess that's
yes, I think that's the number one thing, right? So your homemade ORS is something that you can actually prepare at home, right? So like I mentioned, you get a liter of clean water, you put 6 teaspoons of sugar and half a teaspoon of salt, mix it, and then you drink it after every episode of loose stool. For instance, for an adult, you can take 1 liter after every episode of loose stool. For children that are between 6 to 9 years old, they can consume about 200 mils or maybe 1/5 of that, right? And then for babies, it can be about 100 mils, which is like 1/10 of that. So that kind of preparation can actually be helpful and also helps to keep the hydration status of the individual prior to when they get to the hospital. So you don't, when there is going to be water loss because of choleral infection, that loss has to be replaced. So that is where oral rehydration salts come in, or ORS comes in, and you can do it at home, right? And that is what we are also trying to let people know. So the more they know this, the better it is, so that you don't tilt, tilt the patient such that they come too bad to the hospital, and then we now have to start scampering and looking for what needs to be done.